Well, children could be another step closer to getting vaccinated against COVID-19. Pfizer announced today that its vaccine is safe and 100% effective in young teens between 12 and 15 years old. The company says that during its study, none of the fully vaccinated kids became infected with COVID-19. So for more on this, let's bring in Dr. Susannah Hills. She is a pediatric airway surgeon and assistant professor of ENT at Columbia University Medical Center. So this is some good news. Especially for parents who really want to see their kids, getting back to school full time. In a lot of places, some of the younger kids are able to go back, but they're still very concerned about getting teenagers back into high school. So researchers from Pfizer also say that they found higher levels of antibodies in the group of 12 to 15-year-olds than they saw in young adults. Does this result surprise you? And how important is vaccinating kids for us to reach herd immunity?
Anne-Marie, I'm so excited to be talking about this because this is going to be so meaningful to families who have been concerned about getting their kids back to school safely. Certainly for us taking care of kids in the hospital who have COVID-19, this is really, really great news. This study was a small one, so let me just point out that we don't have completely definitive data yet, but we don't need a ton of data because we've already done extensive testing in adults. So the safety data really is there, at least from the adult perspective. We've got about 2,000, a little over 2,000 kids that were tested, and it looks like the vaccine is safe. It looks like it is effective. And so I think this is going to be really, really meaningful in terms of, one, making parents feel safe sending their kids back to school, and two, really getting a hold of this pandemic for the long term. Because, we've got to remember 13% of our cases of COVID right now are in children in the pediatric population. So yeah, this is a huge step forward. There'll have to be some more data to be gathered to, confirm these results. But it does look like there are plans to submit this data as an extension to the FDA emergency use authorization. And hopefully by the beginning of the school year next year, maybe we'll be set to get kids vaccinated.
Let me ask you about this, Dr. Hills. Researchers from the National Institutes of Health tested blood samples from people who had gotten COVID-19 and recovered before the variants emerged, and they found that immune system cells could still recognize and protect against a new variant. So what does that tell you about our body's immune response?
Yes, so this also is some reassuring news, although, this too is really preliminary data. It's just in blood samples. But what it suggests, what it's telling us is that those who have immunity from getting infected before or from getting the vaccine, their immune system is still capable of recognizing this virus, even when there are mutations in that spike protein. These variant strains that express a mutation in the spike protein can still be detected by the immune system's memory cells. So that is good news. It is sort of a light or a hope and a reassurance that people who've been vaccinated have protection against variant strains. And we sort of have been saying that. It reinforces what we've been saying all along, that the vaccines, Moderna, Pfizer, Johnson & Johnson, do have efficacy against the variant strains as well. And people should feel protected when they get their vaccines. The questions we don't have answers to yet are how long will this ability to recognize any of the COVID-19 strains last, or the durability of the vaccine response. So, we'll see as we get more data exactly what the difference between the variant strains is in terms of the immune system's ability to protect us. But it looks like that's a positive sign for the immune system's ability to protect us against these variant strains.
So the CDC director said this week that a new study found from the agency suggests that vaccinated people do not carry the virus. I thought this was kind of interesting because what we've been hearing all along is, these vaccines will reduce the intensity of the virus should you come across it, but we don't know if you can still spread it. So now they're saying, looks like, you can't. Is this typically how vaccines work? Like, what happens with the flu shot? If you have the flu shot, can you still get the flu? It's just that you don't know about it because it's so mild?
Yeah, great question, Anne-Marie. So this is what we expect with vaccines, just what you're saying, that even if you get the shot, you can still get a mild infection. And this study was in 4,000 healthcare workers, so it's not a huge population. And what they found was that when people were tested weekly after getting the vaccine, they really didn't show that they still carried virus. There were 3 infections in vaccinated folks. There were over 160 infections in folks who didn't get vaccinated. So it was really a strong suggestion that people who are getting vaccinated are being protected also from carrying the virus and potentially also from infecting other people. So this is good news, but it's a small group. There were a few infections, and it really doesn't in any way change the guidance that the CDC has been giving us that we still need to be masking, be implementing the other public health measures that protect us in addition to vaccination, because this is by no means conclusive. And we still do expect the vaccines to be effective, but to have some breakthrough infections. The punchline from the CDC was that Moderna and Pfizer are about 90% effective in preventing infection overall. And so that's still 10% of people who can get some type of infection, they believe, if we're looking at a much bigger, broader population.
All right, Dr. Susannah Hills, thank you so much.
Thank you.